We are totally aware that this is a very rare event. We want to get this worked out as quickly as we possibly can.
Reports of potentially dangerous blood clots, and now the feds are calling for a pause on the single-dose Johnson & Johnson vaccine. Thank you for joining us. I'm Valerie Cavazos.
And I'm Pat Paris. Health experts say those reported blood clots are extremely rare, and the pause is out of an abundance of caution.
Now, here are the key points of the Johnson & Johnson vaccine laid out by the White House COVID-19 response team. 6 blood clots have been reported out of the nearly 7 million people who have received the shot so far. The halt will not have a significant impact on the nation's vaccination plan. That's because the Johnson & Johnson shot makes up less than 5% of the total doses.
We've mobilized a wartime effort so that we're prepared for a wide range of scenarios. And that's why the president took action earlier this year, before the J&J vaccine was even authorized, to secure enough Pfizer and Moderna doses for 300 million Americans by the end of July.
Now, the pause gives an independent committee time to review those 6 blood clot cases. The Pima County Health Department is following the federal guidance to put a pause on using the Johnson & Johnson vaccine.
9 on Your Side's Craig Smith has more on how Pima County plans to keep vaccinations on track and what you need to know about the symptoms.
Researchers found 6 cases of serious blood clots in people who'd had the Janssen vaccine from Johnson & Johnson. All were in women younger than age 50. With the J&J vaccine already in wide use, that's a rate of 1 in 1 million compared to a 1 in 100 risk of death if you come down with COVID. But the Pima Health Department is following the CDC's advice and putting a pause on Johnson & Johnson shots until there's more research. The move has no effect on Pfizer and Moderna vaccines. They are made very differently. Pima County is shifting shot clinics from Johnson & Johnson to Moderna. Pima Health Logistics Chief Spencer Graves says the county will have to adjust to the fact that Moderna requires 2 shots, while the Johnson & Johnson requires only 1.
What we really liked using the J&J for was the hard-to-reach populations that we might only get once. That was the real benefit of the Johnson & Johnson. So going back to using the Moderna is not an issue. We have used it in the past and continue to use it. It'll just require us to go back for the second dose and make sure that we contact all the patients beforehand so they can come back for the second shot.
Graves says if you have a vaccination appointment, it's a good idea to call to see if it's been changed. But he says most vaccination appointments will not be affected because the Johnson & Johnson vaccine has mostly been used in no-appointment walk-up clinics. Pima County says it has had no reports of problems in almost 25,000 doses of Johnson & Johnson given so far. But the county says see a doctor right away if you have any of these symptoms within 3 weeks of getting a Johnson & Johnson shot. Severe headache, abdominal pain, leg pain, shortness of breath. Craig Smith, KGUN 9 on Your Side.
There are 3 major pharmacies in Arizona immediately pausing the use of the Johnson & Johnson vaccine. They are Albertson Safeway, CVS, and Fry's. Each pharmacy tells KGUN 9 appointments involving the Johnson & Johnson vaccine will be canceled. Patients will be emailed with ways to reschedule for either the Pfizer or Moderna vaccine. You might be wondering what happens if you already received the single-shot J&J. Here's what Dr. Anthony Fauci said earlier today.
Someone who maybe had it a month or 2 ago would say, what does this mean for me? It really doesn't mean anything. You're okay, because if you look at the time frame when this occurs, it's pretty tight from a few days, 6 to 13 days from the time of the vaccination.
All right, let's look at Arizona's numbers. About 122,000 doses of the Johnson & Johnson vaccine have been administered. It's a small fraction of the 4.1 total vaccines administered. Now, taking a look at Pima County, there's 572,000 vaccines administered. And as if you can look at the 7-day average, you're looking at about 8,900 administered. You can look at this data by visiting our website, kgun9.com, and clicking COVID mapping in the top navigation bar.